Hi, my name is Candace Barnhart Johnson. This is Rosie. I'm your TA for the CST course, and this is going to be a teaching demonstration of how to do an assessment for your assessment assignment or your evaluation assignment. So, come on, Ro. So Rosie is one of my personal horses. She is 25. She's a North American spotted draft, and she's about 15 hands. I've known Rose for about 18 years, and I've owned her for about 15. So in that time, originally she was in Nevada. She was born in Nevada, and then her first owner after her breeder had taken her to Colorado, then to Pennsylvania, and then to here in Northeast Ohio at the barn I happened to be riding at and training at. At the time she was 6, and I rode her for about 6 months before she was sold. A couple of years later she came up available again, and my family decided to purchase her. So since then, Rose and I have pretty much been inseparable. She has been my main partner, and we've done a little of everything. And in that time, Rose had been she'd been diagnosed with PPID, and it kind of took a toll on her body. It's made it difficult for her to maintain healthy muscle tone and healthy mass. So we do a lot of PT, physical therapy, to try to keep her healthy and try to keep her fit. So other things that she has dealt with over the years is she has arthritis in her hocks. She also has ring bone in her front right pastern. And at some point in her life, I don't know how she did it, but it's probably between age 16 and 19. I'm not quite sure. I don't remember quite when she did it. But she had a muscle tear in the semitendinosus of her right hind leg, and it left her with a very large fibroid of scar tissue, and it limits her stride. And so she has almost like a goose stepping kind of motion in the right hind. And so when she first comes out of the barn in the morning, when she moves, you can hear this kind of slapping kind of sound. Her gait is very loud. Her trot is very loud, and it's hard for her to canter. Now, the longer she's out of the barn, the better she gets, the more she works out of it. And when she's in consistent work, it's almost non-existent. And recently, I haven't been able to keep up with work with her because I was pregnant. And so we've gotten back into work. And now that we've gotten back into work, a lot of her areas of soreness and stiffness have started to flare up. So I'm going to take the opportunity here to show you how to evaluate a horse, and then why CST might be helpful for her. So to start off, CST will be helpful for her to help release overall body tension. Granted, there's all sorts of things that I can do for her, but CST itself will be able to help release a lot of that overall body tension and things that she holds on to mentally and emotionally as well as physically. Rose has always been a very stoic horse, and so it's difficult to tell when something is bothering her because she has a tendency to just act as though nothing is wrong. She could be four-legged lame, missing 2 feet, and she'd still try to canter for you with a smile on her face. And so it's not always easy to know when something is wrong, but you can see it in her body because it shows up in her muscling and how she carries herself. So that'll be the goal for CST sessions for her. And again, for the purpose of the video, we're just going to go through an evaluation. So the first thing that I'm going to do is show you a gait assessment so you can see how she moves, see where the problem areas might be, and then we'll go into the physical aspect of the assessment. All right, bear with me, I'm trying to change my hands here. Okay. So right off the bat, you can see how Rose has a dip in her back, and it's not kissing spine. It's also not conformation. Rose, when she was younger, had a nice, beautiful, straight back, and she carried herself really well. This posture that she's developed has a lot to do with Cushing's and her lack of core strength, partly because of that, and partly because of lack of physical fitness as she's gotten older. A lot of it also has to do with the arthritis in her hocks. It makes it difficult for her to really drive underneath of herself and use her body the way she should. So as she walks by here, you can see that dip. She's like, I want to trot. But you can also hear how that stride is a little louder than it should be. That kind of thud, thud, thud. Although she is tracking up really nice, all things considered. She's doing pretty well. That nice long strided walk. But when she trots, she gets very tight through the base of her neck, her shoulders, and her chest, and she throws her head up, and she has a tendency to pull herself along, as opposed to the gait starting in her rear end and her driving herself and carrying herself forward. It's also a pretty abrupt transition, so it doesn't look smooth, it's not comfortable, although her downward transition is smoother. Let's see if you can trot again. Good girl. So while she does try to use her back, it's very difficult for her to really push up, engage her abdominal muscles, engage her hind end, and really drive herself forward. Come on, babe. Good girl. Good girl. And so on any given day, Rose does deal with a little bit of lameness, but it's kind of like a come and go type of lameness. It's not an everyday lameness. We'll see if she can canter this way. Come on, Ro. Canter. Canter. Good girl. Okay, so she can canter, but it's hard to maintain it, especially when she's turning. We'll see her from this side. Hi, sweetie. Good girl. Why don't you go that way? Come on. There. Good girl. So again, from this side, you can see she's stiff. She's not rounded. She's not using her back properly or her hips properly. I'm sorry, her haunches properly. Come on, Ro. See if she can canter. Canter. Rose, canter. Canter. Good mare. Canter. Good girl. Whoop. Careful. Good girl. Okay. So as you can see, it's really hard for her to really get her hind end underneath of her. She's not engaging her rear end. She's not lifting her back. Her abdominal muscles are really dropped, and she's literally just pulling herself along. Very flat canter, very little self-carriage, and it's very hard for her to maintain it, especially when she's turning. She can do it on a straight line, but it's hard for her to turn. So I'm going to ask her to back up so you can see how she backs. Good girl. Good girl. So again, as you can see, yes, she is backing, but she's dragging her feet backwards. She's not picking them up
stepping and placing them back. She's quite literally just dragging. And again, it's lack of strength in her back and in her rear end and lack of ability to carry herself on her hind end and lift up off those shoulders. Okay, so we're going to go ahead into the hands-on assessment now.
Back up. Good girl. Okay, so now I'm going to go into the hands-on assessment. Now the first thing I'm going to do, because she's a little bit impatient with the whole cookie situation, I'm going to ask her to do some stretches. And the purpose of doing the stretches is to show range of motion through her head, her neck, all the cervical vertebrae, not just the neck in general, but all the cervical vertebrae, all the muscles here, through her chest, her shoulders, and her back. So what we're looking for is whether or not there is any resistance, her own resistance, or if there's muscle resistance. So if you can see muscles straining or having a difficult time extending or contracting, if there's anything that she's trying to fight herself to do, or even still if you can see any muscle spasms, muscles trying to work and not being able to. Or just in general, if you can see or feel any general pain or resistance, just how far back is she able to reach. So I'm not going to force it, but I am going to give her incentive to stretch. Now, you can do this one of two ways. You can, if you've got a horse that you can fake using a treat, you can do that. Or you can actually have an incentive and make it a more positive experience for them and, have them do that stretch. So I'm going to ask that she turn around for me so you guys can see this on the camera. And all I'm going to do is show her the treat, offer it to her, and see how far back she's willing to reach. Ideally, I want to see that they can get their nose at least to their flank, but if she can reach back further without a whole lot of difficulty, then that shows me she's got a pretty good range of motion. While she's doing that, I'm also going to take a look at her back and her neck and see how difficult it was for her to do that based on what her muscles were doing. So now I'm also going to ask that she turn and do this side. Good girl. Ordinarily I wouldn't turn her around, but I want the camera to be able to pick it up. So same thing over here. I want to see how far back she's offering to put her head down between her knees. I want to see how far back she's able to reach. Now it seems to be harder for her to reach on this side, the left side, than it was on the right. And one thing I'm going to note is that in her mid-back, right around maybe T14 through T16, there was a bit of muscle tension, and it was a little bit hard for her to really bend around herself. Just right off the bat, looking at that, just because I did notice it, she also has a little bit of localized edema and swelling over those particular spinous processes as well. And I think a lot of that is there's something going on there that she needs a little bit of support with. She's very sore there. So the next thing I'm going to do for her is I'm going to ask and see if she can put her chin to her sternum, or how closely she can get her chin to her sternum. And the reason I'm going to ask for that, and again, I'm not going to force it, I'm just going to offer it to her and see what she can do. I want to see how flexible she is through her back. All right, so that was pretty good. Other stretches you could do would be to take the treat and go all the way to the ground, to their feet, and see if they can reach all the way down, reach back towards their hooves, not just straight down. we're going to use up the rest of these treats just because. Another option would be to see if they can reach up high on their back, how far on their back they can reach. Girl. And again, I'm not forcing this. This is just however far she is willing to reach back on her own. She's really not willing to reach, she's not really willing to reach up on this side. So that's interesting. She's not too keen on reaching up. And looking up at her back, there's a lot of tension there when she does. Okay, so you don't necessarily have to do those stretches, but it is a good indicator of whether or not she's got something going on in her back specifically. And like I said, because I do know that Rose has trouble with her back, it does make it easier for me to assess where specifically it happens to be without physically palpating her. But I'm going to go into a little bit of palpation around her face and the rest of her body. Okay, so looking at her eyes immediately, there is no weepiness. Mucous membranes are good. There's no redness, no cloudiness of her eyes. No overdeveloped muscles through her head here. I don't feel that her frontal bone is pushed out more one than the other, or that the parietal bone is pushed out more one than the other. No reaction or response to facial nerve palpation. No reaction or response to TMJ. And in general, looking at her face, I don't see any obvious asymmetries, or at least anything that really jumps out at me. And looking at her nostrils, they appear level. Gonna open her mouth, look at her gums. And she's got nice good color at her gums. Although she's not interested in me with my fingers in her mouth. Good capillary refill. I'm going to look at the set of her jaw, if she'll quit moving. She's not wanting to quit moving her lips here. I'm going to wait until she gets quiet. She doesn't have any hooks. No over or under bite, no cross jaw. Everything looks straight there. Get her pull. See if there's anything going on with pull. Nothing specific to note. Although, right here, quite a bit of tension coming through the splenius. There's quite a bit of tension here. Significant tension. Right here, there's a big knot on the left side.
Not so much on the right, but there's a pretty good sized knot here on the left side. There's no overdevelopment of any one particular muscle group, so that's good. And coming through her chest, same thing. Nothing is over or underdeveloped. And no real obvious asymmetries. The one thing you might want to note or take a look at is the pectoral muscles, and see if they're roughly the same size. If they're not, that can indicate that the horse is really severely compensating. I'm palpating down her forearm. There's no immediate reaction through her shoulder and deltoid. No immediate reaction. No reaction to palpation of the back edge of the scapula into the logisimus. Going down the logisimus. There's no immediate pain response on the left or through the girth, the ribs, although she's very itchy, she's wanting me to itch her. Very, very itchy. Her glutes are all really nicely developed, although there is a bit of tension through the glutes, but not too bad. A bit of tension in the semitendinosus, semimembranosus. No response to stifle palpation, although I can feel a bit of creaking in the stifle underneath my hand. Come through, palpate her neck on the right side. Does it feel good? Rose loves getting worked on, so she's itching, just waiting for me to start doing something. There's a little bit of tension here on the right shoulder. A little bit of tension here, especially in the deltoid. A little bit of tightness. Nothing nothing palpates in the right forearm. Back of the shoulder is good. No obvious response at the girth, although she's very itchy, so she's wanting me to itch her. No palpation or pain response at the logisimus, although she stepped back and she righted herself, so she did kind of lift her back a little bit. Nothing through the ribs. Coming up through sacrum and glutes. So what's interesting is she's a little bit less developed on the right side. The right glute is a little less developed. The tone feels different. It's a little squishier. And of course I'm going to make note of the fibroid in the semitendinosus of the right hind. Now, there are some days where she's got a little bit of localized edema and swelling around it. Today is not one of those days. And there's no reaction to palpation of the stifle joint on the right leg. Okay, so I'm going to go ahead and ask her for her legs, and we'll see what her range of motion is for her legs. I'm going to try to get her better on the camera here.
Come on, Rosa. Come on. There you go. Okay. So, especially for senior horses and horses that have arthritis or anything going on with their legs, big pet peeve of mine is people who will pick up their horse's legs without the horse being squared up first. I want to know that I'm making this the most positive experience possible and setting the horse up for success. And so if I pick up their leg when they're not quite balanced, I'm not really showing them that they can trust me and that I am here for them. And I'm not going to ask them to do something that would cause pain or discomfort or make them uneasy because they feel like they're going to fall over. So I always want to start with them squared up before I go to pick up the leg. And I'm also going to ask in a way that doesn't feel like I'm snatching it up. So I'm going to ask by finding her chestnut. I'm going to just kind of tickle it or just barely pinch it. And what I mean by pinching is just kind of, you just kind of squeeze it. Not hard, but just enough that she knows that you're there. And I'm going to ask. And when she lifts it, I'm going to let go, but I'm going to hang on to her leg. So, right off the bat, it's hard for her to compress. There's quite a bit of resistance in trying to compress her knee. It's actually physically hard to get her heel all the way up to her elbow. Now, she's not reacting in any kind of discomfort. It's just difficult to get the joint to want to stretch that way. Rotate the knee, see if there's anything going on there. So there's limited motion in the knee side to side. There's no creaking though. So I'm not going to say that there's arthritis there, but there very well could be just a lot of tight tendons and ligaments. I'm going to ask if she pick that up again so I can get the fetlock. Although the knee did pop right there as I was trying to get it up. So there is very little motion in that fetlock, side to side. It's very, very tight. And while I can compress the joint, there's a lot of resistance. Not necessarily resistance from her, but just from her tendons and ligaments, there's a lot of tightness. Go back to this hind leg. I'm going to find the back of her hock and gently ask her to pick that up. Now, she can pick it up, but she doesn't really want to hold it up. Come on. Pick her up. And the minute I pick it up, it's very heavy. She's really not stable, and she really doesn't want to hold it for herself. She's very much relying on me to hold it. So let's see if she can extend it a little bit. And I don't think that's going to happen. Because she's really leaning on me. I'm going to try to compress this, which is very hard because she's really unstable. And I don't think that's going to compress a whole lot. And extension forward. There's a lot of resistance. So it's very hard for her to compress at the hock. Very difficult for her to compress at the hock. Same situation. I'm not going to pick up her feet until she's squared up. I'm going to ask that she back up to square for me. And then I'm going to ask for this front leg. Oh, and right off the bat, she's almost waiting for me to hold her up. And very, very difficult to compress that knee up to her elbow.
I can do it, but there's a lot of resistance. See, you've got the mobility of the knee. It's quite a bit more mobile than her left side, which is interesting. Not a whole lot of mobility here in the fetlock, a little bit of clicking. I'm gonna go to this hind, see if she'll step up for me. She's backing up. Come on now. Good girl. Come on. So same thing on the other, with the other leg. It was very much, she didn't really want to pick it up. Although she's not as unstable. Doing a lot better on this side. She's willing to extend it back, which is good. And can compress that hock pretty easily in the stifle, and then extension forward is pretty good. So I'm also going to ask that she pick up these front legs. And see if we can extend them. How much extension she's got. And how much resistance there is. So she can extend, but there's quite a bit of resistance. She wants her foot back. This side's a little bit better. She can extend, but she's kind of unstable. She's trying to pull her foot back. Come on now. Okay. So based on that assessment, there's a lot of tension in her rear end, specifically in her hocks and probably through her sacrum, through her lumbar. So I would probably focus on those areas. She's got a knot here in the first, probably third and fourth cervical vertebrae, I would say. And at the insertion point of the sponneus, way up here, it's got a really nice big knot. So going through and focusing on those areas would probably be quite helpful for her. Okay, so there you go. Thank you for watching.